In a significant move, the Meghalaya Cabinet, led by Chief Minister Conrad K. Sangma, convened a meeting at Resubelpara in North Garo Hills as a part of the quote, Cabinet on the Move unquote, initiative. Key attendees included Cabinet Ministers Dr. Ampareen Lyngdoh, Shakliar Warjri, Paul Lyngdoh, Marcuis Marak, Rakkam A. Sangma, Comingone Ymbon, A.T. Mondal and Kyrmen Shylla. Key decisions approved by the Meghalaya Cabinet include the regulation of private medical institutions through the Meghalaya Private Medical Institution Regulation of Admission, Fixation of Fees and Reservation Ordinance 2024 and the Meghalaya Medical College Regulation and Admission into MBBS Course 2024. Others include the rental housing regulations to regulate rental houses, government quarters and rental housing schemes for Meghalaya government employees, the relaxation of age limit for SSA teachers to participate in recruitment exams for government schools, and the loan for human capital development to support human capital development in Meghalaya Phase 2 project. These decisions aim to improve the state's healthcare, housing, education and economic development. The meeting demonstrates the government's commitment to addressing key issues and promoting progress in the state of Meghalaya.
Rental houses, flats, quarters under the rental housing scheme to the government employees in Meghalaya. Actually, wherever in every district of the state, we have a housing property the government of Meghalaya has already created. So these housing buildings owned by the housing departments have already created the MIG, middle income group buildings, low income group buildings, and has already given a rent to government employees. We were not having any rules for that. Anybody who doesn't pay the rent, we don't have any rules to impose on them. If they don't pay the rules, we don't have any rules based on which we can take action. So therefore, these rules today. So this is a rule to regulate the rental housings of the housing department.
Is availing loan from the Asian Development Bank for implementation of the project Support Human Capital Development in Meghalaya Phase 2. Cabinet was pleased to approve this proposal, and as per the Cabinet note, government will now avail a 90% grant from the ADB, and out of this entire loan, 10% of it is a loan which the government of Meghalaya will pay in the long run. 90% of this loan will be paid or borne by the central government, as has been done or has been the practice all these years. The Meghalaya Private Medical Institution Regulation of Admission, Fixation of Fee and Reservation Ordinance 2024. Cabinet was pleased to pass the ordinance, which will come into effect post signing of the Honorable Governor of the state. Following that, the regulatory committee will be notified, and accordingly fixation of fees, application of reservation policy, distribution of seats as per norms of government, guided by various rulings of various honorable courts throughout the country. We now have approved it, and the USTM will be allowed to operate soon after the ordinance is signed by the Honorable Governor and it is duly notified. The regulating committee will then sit to guide this private medical college on matters of fixation of fee, on matters of application and implementation of reservation and allocation of seats.
There are many SSA serving teachers who are already qualified and the MTET pass, but they are overage now. So therefore, just to give them room so that they can apply for their recruitment in the government, LP, UP, and higher as category. So we have decided that to give upper age, they will extend up to 45 years. So those who are qualified, but they have to follow the due process. They have to apply, have to be sit for the interview and all. So therefore, we just give them upper age level up to 45. That's all.